This is the 16th Ebola virus outbreak in DRC. The 16th pandemic is happening in a specific context. As recalled, you have a context of insecurity, there's a humanitarian crisis and a strong concentration, demographic population and mobility, despite the health system being almost inexistent in the region. We have been able to detect the pandemic, and thanks to the WHO support and other partner support, a response is being organized and implemented, and it becomes stronger every day. In our country, we authorize children's vaccination when it comes to the Zaire strand, because cross-immunization is a hypothesis, and we hope that that will help us contain the pandemic, or this outbreak. So we are also open to trials and research for other vaccines in collaboration with WHO, CDC Africa, and other partners. Currently, we have received 16,000 vaccine doses out of 50,000 expected, and we're still working on the surveillance strengthening, and strengthening also the response within the community. And the government mobilized and disbursed $50 million in order to boost the response to this outbreak. We remain confident that with the concerted efforts of the international community and regional community, we will be able to contain this outbreak, and we will be able to cast out this disease from Africa and avoid its spilling over in the whole region, on the whole continent, and in the rest of the world.
Uganda wants to add its voice to thanking the many partners not yet listed on those who have responded and supported the response to Ebola. I realize that list was not exhaustive. Secondly, we want to appreciate the President of Uganda for allowing Uganda to deploy its health workers across the border. A true test of solidarity. So as you fund the response, Uganda has already set up 2 treatment centers and 2 laboratory setups, and we are yet currently expanding the 3rd. We look forward to partnering with those who want to support DRC through Uganda, and many are doing so. Finally, Chair, 30 days ago, Uganda declared the end of our outbreak. Because this was a unique outbreak of imported cases. Uganda stands to share experience, including sharing with WHO, in how to revise the declaration protocols, including treatment, because we've shown that we currently have only a case fatality rate at 20%, 10%, not 20. That can be different if you allow WHO also to learn from Uganda.
As the UN Agency for Migration, IOM recognizes that population mobility is a critical consideration in all outbreak response and preparedness efforts. Migrants, cross-border traders, transport workers, refugees, IDPs, pastoralists, and border communities are often among the first populations exposed to these emerging public health threats, as shared also with member states in this meeting. While they also face major barriers to this, in support of government-led efforts, IOM has scaled up operations across different countries which are at risk, as well as those that have been affected, with significant work in DRC, Uganda, South Sudan, Rwanda, Burundi, and other member states. To date, we have mobilized more than 23.6 million USD and provided more than 19.8 million health screenings at 227 points of entry. Through population mobility mapping, IOM is working closely with governments to identify high-risk mobility corridors, congregation points, border communities, and formal and informal crossings where disease transition risks may be elevated.
To support the response, Gavi has mobilized $50 million. This includes $40 million to accelerate access to potential vaccine against Ebola virus, and $10 million to help affected countries including DRC and Uganda, to protect frontline healthcare workers and sustain essential immunization services. Gavi has also invested significantly in regional coordination efforts through support to key partners, including WHO, Africa CDC, and UNICEF. In addition, through the Gavi-funded Ebola vaccine stockpile, more than 70,000 doses of Ervebo have been made available to support studies on cross-protection and the vaccination of frontline health workers. Finally, Gavi remained fully committed to supporting the people of the Democratic Republic of Congo and all countries facing the threat of Ebola. We will continue working alongside government and partners to support response efforts and help ensure that vaccines can contribute to bringing this outbreak to an end.
I think one of the lessons learned in this outbreak is that a virus doesn't respect borders. So we do not also, think that our border, we can close border. In Africa, we don't have borders. We have population living all over together. They are doing market together. They get married together. They have children cross the border. So administratively, we can say we have borders. But when we look at the way of living of our communities in Africa, we don't have borders. So this is why we are having those MOU or memorandum of understanding on how to share information. What kind of information should be shared between countries? The real-time sharing information, how we can make more coordination across borders. So now population don't need to be restricted of movement, but they know where the services are available so they can access to the service.